Good day. I'm Dr. Kamanis here in upstate New York at Capital Area Plastic Surgeon. I'm a board certified plastic surgeon here today to discuss microneedling and platelet-rich therapy, or PRP. This is kind of a new thing in the last few years. Many of you maybe have heard it through vampire facelifts, where people take their own blood and they inject it into areas. What I'm talking about is a little bit different, but it is similar. We do take your own blood and spin it down and take the serum, which has the platelets in it and growth factors. And then we take a microneedling device, which is a pen, and make controlled perforations or controlled injuries in the skin of the face in order to apply it to better improve scars or wrinkles for facial aging, and kind of give it that more plump look and a rejuvenated face. It works by stimulating growth and stimulating healing after these micro and controlled injuries by causing more collagen to be produced into the area of the small injured sites, and also new vessels, blood vessels, to be formed. The theory is that the platelets that we take from your own body, we spin them down, and the serum is then also put on the face, and we use it for a gliding mechanism, but it also promotes certain hormonal factors and growth factors into the skin to try to give you that rejuvenated face. We're going to show you a video on how we perform this procedure. It's quick, it's in the office, and the thing that patients like about it is that there isn't a lot of downtime, and the injury is quite specific in the superficial area of the epidermis. But the results, patients that we have experienced in our practice really love it. And it's also pretty cost effective. So we look forward to seeing you, and I hope you enjoy the video. And it's platelet-rich plasma. This is PRP, and it's rich in hyaluronic acid, which is already in our skin and our subcutaneous tissue. And hyaluronic acid, as people know, helps to fill and regenerate collagen in the area to try to give you more of a youthful appearance. So we spread this along the face so that the microneedling pen, the Eclipse micro pen, will actually glide across the skin and give us a better surface to work on. We do 3 to 4 treatments, 8 weeks apart. And so far we've been getting, from all our patients, we've been getting some really dramatic results, which is great. And we start off going vertical, in a vertical line, covering all of the area of each quadrant of the face. I like to break it up into 4 to 5 spots. I do the forehead first, and then I go along the sides, then I do the cheeks, nose, and then we do around the mouth and the chin area. And you go vertical first, and then you run it horizontal, like this. And then we're going to run it. After then we do one more thing, we run it diagonal. It's almost like aerating the lawn. You try to just make as many little perforations, and what that does is it produces inflammation, and along with the collagen that's in the PRP, the platelet-rich plasma, causes wound healing and improves the skin quality, and can take away some of the wrinkles as we get from sun damage and from aging. I'd say they'll feel a little prickle, but it's not usually excruciating pain, but some people just fly through it, like Maxine is. So now I moved on to the side. You try to get the little crow's feet that we can get from sun and just from squinting, which we all get. And this machine is great for this area too. And you can combine this later on with, obviously, maintenance, cosmetic type lotions, and retinoic acids later on, and also with any Botox or any fillers if needed. Maxine doesn't really need that. So yeah, so Maxine will come in 8 weeks later to get her final one. It will be her 4th treatment. And then we'll convert after that to just maintenance treatment, because if you're in the sun, especially in the summer, you can can still age and kind of optimize our results by not allowing the sun to do too much damage. Although some sun is good though, because you get vitamin D, but too much sun is not great, because then we get wrinkles and we get sunspots. So try to balance that. And you'll see sometimes there's a little bit of punctate bleeding, which is good. That's a good sign. That means we're getting into the right depth in the epidermis. And then I also spend a little time around the nasolabial folds. That's these areas here, the creases around the mouth, because that's where we animate. And then as we get older, the creases deepen. And by just concentrating a little bit like this, we can smooth these areas out, and above the lip. And the whole process takes about 15 minutes. It's not a long procedure, just more the prep time, because we bring them in 30 minutes before usually, and we put the lidocaine cream on like this. So. And that's almost it. Close. Just a few spots over here. I think we're good. Alright, and that's it. That's all it took. Microneedling is pretty straightforward, pretty minimally invasive, and patients tolerate it. And the good news is that all this bleeding and all this redness, by the evening time, it starts to subside. And then by tomorrow, Maxine could go out to dinner or go to a party and go swimming or whatever she'd like to do, and there isn't a lot of downtime compared to if you're doing a lot of laser work and stuff. And patients really love that, because you're able to do it one day, and then by tomorrow you're really kind of doing whatever you want. I just tell them to make sure to put on sunblock if they go out in the sun.